My name is Hilary Godwin, and I'm the new Dean of the School of Public Health. Welcome to our 7th PRiSM event. I'd like to especially welcome members of the SBH Dean's Council and the Department of Global Health's Leadership Council, Sanjay Cheda, Jane Korn, and Brooke Simpson. Yay, and you guys are all sort of sitting together too. And welcome to everyone else, of course, as well. We think you'll really enjoy tonight's event. You'll get to hear from 3 of our faculty who are all researchers approaching different aspects of tonight's theme. Tonight's title, Farm to Fork, Food Systems in Our Health, is both timely and important. It's about the challenges that are faced by our modern day food system, from production to distribution to consumer safety and its impacts on our health. You may also recognize that food systems and human health comprise the focus of our newly established undergraduate major in the school through the nutritional science program, which we're very excited about. The new interdisciplinary food systems, nutrition, and health major fills an existing gap in academia by creating intellectual synergy between food systems, nutrition, and population health. Students will study issues related to the food supply chain, the food environment, food business practices, food science, and the culinary arts. Alumni from the program will go on to assume professional positions in the federal, state, and local government agencies, international and domestic NGOs, academia, and probably the food industry as well. So we featured the new major as the lead story in our alumni newsletter, which is called SPH Connect. If you haven't already received a copy in the mail, we have copies here, and you're welcome to take one home with you. So as we move into the main part of our program this evening, I'd like to start by acknowledging the Coast Salish people of this land, the land which touches the shared waters of all tribes and bands within the Squamish, Tulalip, Duwamish, and Muckleshoot nations. And we say these words at the beginning of events at the University of Washington to honor the people on whose land we are guests. Within public health, we're unified by a strong calling to do what we can, each according to our abilities, to make this world a better and more equitable place. We do this work not for communities, but in partnership with them, because we believe that the best solutions come from within. PRiSM is one of the ways in which we reach out to you as cherished members of our community and ask you to partner with us to help develop solutions. Tonight's program focuses on a topic that's really core to the health and well-being of all people. Ensuring that all people have access to safe and nutritious food is a central concern of communities worldwide. It is a core concern in the field of public health, and one where we have to work with stakeholders from a wide range of disciplines and backgrounds if we are to develop effective and sustainable solutions. So here's how our program is going to work tonight. We have 3 fantastic presenters this evening who are each working on different aspects of the food system and health. They're each going to give you a very brief overview of the work that they've done to either identify solutions and or work with partners to develop solutions to those problems. And I'll introduce them all at once now, and then each one will come up in turn and give their presentation. We ask that you please hold your questions during their presentations. There are note cards on your seats where you can jot down any questions that you have, and we want you to keep those for the small group discussions that we're going to have after all the speakers present. So you'll notice that your name tags are color-coded with dots, so like I'm a blue dot. And after the presentations, we'll break out into smaller groups in adjacent rooms based on the color dot that you have. And then each presenter will rotate through the 3 different rooms. So each group, regardless of what color dot you have, you'll get to meet for 15 minutes with each of the speakers and ask any questions that you might have and engage in discussion. We'll have facilitators in each of the rooms that are going to help to moderate the discussions and also take notes on any key points that are brought up so that we can synthesize your input into a set of recommendations based on tonight's event. And so if you want to see like a summary of sort of our great insights from the event, feel free to check out my Twitter feed in the coming days where I'll post some highlights of sort of great insights that we got. We also, I wanted to point out, have some students in the audience tonight. And their name tags designate them as students. So you can tell, I'm taking off my glasses so I can actually see, they're the ones who have the purple student badge. Makes it easy to see them. So if you haven't already had a chance to talk to the students, please do chat with them. They'll be scattered throughout the different breakout groups. And they're here both to learn themselves, but also to engage with you guys. And then after the discussions, we'll reconvene here for coffee and dessert, and that'll conclude the evening. So it's not super long, but it should be fun. Okay, so next I'm going to go ahead and introduce tonight's presenters. So the first speaker is Scott Meschke. Scott is a professor and assistant chair of environmental and occupational health sciences, and he's also an adjunct professor of civil and environmental engineering. He's an environmental and occupational health microbiologist, specializing in the fate, transport, detection, and control of pathogens in air, water, food, and on surfaces. This evening, he'll present on the consumer safety side of food, of the food system as it relates to foodborne illness. After that, we'll hear from Peter Rabinowitz. Peter's a professor also of environmental and occupational health sciences, as well as global health and family medicine. He's also an adjunct professor with the Departments of Medicine and Epidemiology. Peter directs for us the Center for One Health Research, which explores linkages between human, animal, and environmental health, including zoonotic infections at the human-animal interface, animals as sentinels of environmental health hazards, and clinical collaborations between healthcare providers, veterinarians, and species using a species spanning approach. Sorry, Peter. Tonight, Peter's going to discuss the farm environment and One Health approaches to help safeguard animal welfare, environmental protection, and human health. And then last but not least, we have Jonas Sipos. Jonas is a lecturer in the Department of Environmental and Occupational Health Sciences and a core faculty member in the Nutritional Sciences program and lecturing in our new major. She works at the intersection of food systems, community-engaged scholarship, sustainability, and equity. And this evening, Yona will discuss alternative food systems and community-based solutions to food insecurity. So with that, I'm going to turn it over to Scott.